Coming up next, you'll have an opportunity to meet a nursing professor who has her doctorate in nursing, who is a specialist in the concept of nurse burnout syndrome and nurse traumatization, a factor that influences us in our clinical role and also in our role as entrepreneurs working with attorneys. My next guest is Dr. Loree Laws, and I'm going to ask you, Loree, if you could give our listener or our viewer just a taste of the topics that we covered in your podcast.
Well, we covered a lot of ground in a short time, and really we started untangling the difference between nurse burnout syndrome and nurse-specific traumatization, which is a relatively new concept in the evidence base and a new middle-range theory around that we can use in our practices, including legal nurse consultant practices. And then we kind of unpacked a little bit, like, what is this? How do nurses specifically nurses, get traumatized in our professional roles? And importantly, what can we do about it? How can we prevent nurse-specific traumatization? How can we differentiate it from burnout? And what's a practice? What's a key practice that the listener can walk away with and do in under 30 seconds, even under the busiest of days, throughout the busiest of days? So we talked about that and so much more, and I do hope that you'll join us in the next episode.
Thank you so much, Loree. You'll have to tune in to find out what Loree is referring to when we talk about a simple practice that will help shift your perspective and deal with some of the more common stresses that you encounter in your life. Dr. Loree Laws is our next guest on Legal Nurse Podcast, and I hope you'll come back and watch her show on YouTube on our Legal Nurse Business channel, or listen to it on all of the audio channels. Take care, and I will see you again soon.